Today, Sylvia Jones, Ontario's Deputy Premier and Minister of Health, announced the imminent closure of 10 of the 17 provincially regulated supervised consumption sites in Ontario. This is an immense loss for the community and a direct reactionary attack on the health system of all Ontarians that must be challenged by all who can.
We know that supervised consumption sites in Ontario have had a direct and measurable impact to prevent death in our communities. There have been no deaths from an overdose in a safer consumption site. Meanwhile, people across Ontario die alone in their homes from the toxic drug supply. Along with that, there has been a 67% decrease in deaths within 500 meters of the sites built in Toronto, as published this last February in The Lancet.
In just this past July alone, 290 people in Ontario have been killed due to the toxic drug supply. And in spite of advocates demanding expansions to these programs to save more lives, the Ford government again has chosen to deny the people of Ontario critical health services. As disabled people in Ontario, we're pretty used to cuts and denials of service from this government that undermine all aspects of care in this province.
Political reactionaries, like the provincial Conservatives, have attacked community health centres and placed a rare focus on Ontario's school system to scaremonger and justify peeling back services to the community. Yet, instead of investing in any of these systems, the Ontario government creates barriers for care while allowing systemic violence against youth inside schools to continue unabated.
In this time where reactionary forces threaten our communities, where right-wing economic ideals undercut the capacities of all of our social systems, we cannot allow drug users to become scapegoats for state violence and isolation. This government, like those before it, has failed to address the toxic drug supply, failed to address interlinked policies on housing, social supports, and healthcare, and failed to do anything at all but undermine and kill disabled people, drug users, care workers, and Ontarians at every turn.
We need to tackle each of these problems materially, with proven solutions and ways forward that do more than fill conservative opinion columns and inevitably the bank accounts of the Premier and his friends. We can't fight austerity with more austerity. It doesn't work, and we know exactly who will be most impacted by these closures. We demand that the Ford government stop killing and criminalizing our friends, reverse the planned closures, and regulate the drug supply immediately.